When patients are completed their procedure in the clinic, the doctor will take, or the provider, the hygienist or the doctor, will take their routing sheet and they will usually be making notes on the routing sheet as to anything that needs to be communicated either between the providers or between the providers and the front office. One of the items that might be written on the routing sheet is a difference in the amount that the provider wants to have the front collect from the patient. So when the doctor brings up the routing sheet, they might be preceding the patient actually walking up by even up to 15 minutes. If it's a bigger extraction, the doctor might ask the patient to just sit there in the operatory until they feel 100%. And so that routing sheet allows the front office to know who that patient is and what they need to do with that patient. And every single patient is instructed to see the front office if they have a balance. So when a doctor drops off the routing sheet, they will either say the patient is good to go, meaning the patient is okay to walk out the door, or the patient knows they have a balance. Now, there's two ways to figure out what the patient balance is. If the doctor wrote on the routing sheet $100, you'll collect $100 no matter what EagleSoft says. Now, if the doctor says the patient knows they have a balance, that means that we're supposed to collect everything that EagleSoft says, okay? So let's take a look on how to see that balance. So when you click on the patient, you'll take the routing sheet, you'll get the patient name, and then you will click on the account tab and you will see this due now. This is the amount that is due from the patient. Okay. It's not this balance and it's not this insurance. It's the due now. And so what you'll do is you'll take the payment from the patient. Okay. And in order to take a payment, you'll simply go to the account balance, you'll choose credit card, you'll type in the amount, or if it's cash, or if it's check, you'll choose the appropriate payment type. You'll type in the amount. And then with this computer that I'm recording this video on does not have a credit card machine hooked up to it, but you'll click on save. It'll come up with the prompts on the computer and on the terminal, the credit card terminal, to accept that payment, and you'll see that it'll be applied to this account. And we'll have a video that kind of goes over that a little bit more. Some patients are trying to get out very quickly without paying their balance, so it's important to be very vigilant on what's exactly going on in your waiting room and which patients are coming out of clinic. But all of them should recognize that they need to check in with the clinic, and you can say, "Yep, you're good to go," or "Yeah, let's go ahead and get that patient balance taken care of." Now, there is what's called a discuss finances alert on the patient. And it could be that the patient had a past balance. They came in, and usually fronts are not going to be alerting the patient that they have a balance. All financial information or all financial discussions are are discussed in the clinic with the providers. So it takes off a lot of work from the fronts that they don't have to figure out why the patient has a past balance. Now, we have seen in the past that fronts get into that conversation with patients, and then the patients get upset, and then that financial discussion is in the waiting room. Other patients get stressed out. So again, if there's a discuss finances alert, usually on the routing sheet, you're going to have highlighted that there's a past balance due, and then the doctor will look at their account, make the discussion in the back, and then when the patient comes up, they'll make the payment or create the payment plan or take the care credit payment, and we'll have a video for each one of those. But if they are paying off their balance, so for example, if this patient If we're taking a payment today for their entire balance, let's say that we went in here, did an account payment on the credit card, 238 or 2,378.80. We save that. We would also want to remove this discuss finances alert because they have made their entire payment. So we'll go ahead and remove that, and then the patient will be good. Okay. So I'll go over briefly on the generic open and affordable collection policy. Now, there are different collection policies per office. So discuss the collection policy that you have in your office with your doctor to make sure that everyone is on the same page. But it's very important that we collect everything that we produce in the clinic. And our experience has shown that, unfortunately, not all patients pay their bills. So we have put up signs in the office, and you will see those that explain that patients are really responsible for all of the uh, payments that, or for all of the procedures, minus what their insurance pays for. So we try the best that we can among the fronts and among the doctors to come up with a treatment plan that estimates the amount that the insurance is going to pay. But if the insurance doesn't pay, the patients are responsible for that remaining balance. So there's a lot of, I wouldn't call them errors, there's a lot of different parameters that go into getting an accurate insurance benefit breakdown. But even with the best breakdown, we can't guarantee that those fees are absolutely accurate. The thing that really controls how much the patient owes is dictated by the explanation of benefits. And when we do a procedure and we submit it to the insurance company will send a copy to us as the office, but they'll also send a copy of the explanation of benefits to the patient or to the member, so that the patient should also understand that's what really dictates the amount that's due. Besides that, we try to minimize these patients that don't pay for their treatment by implementing these particular rules, which is all treatment over $1,000 should be prepaid by the patient. Patients should prepay for lab case deliveries before being released from the front of the clinic. So, one, if we're looking at a delivery, that's the important thing. If we're in the middle of a denture uh, procedure, there's going to be several different steps, and all of them have lab cases. But it's the delivery appointment where we should be collecting for the delivery of the denture before letting the patients go back. When we're delivering a crown, we should collect the amount due before they go to the back. Now, if there's any type of argument from the patient, just go ahead and approach the doctor, and the doctor will make the decision if they're going to let that patient back and seat the crown, or if there was some other arrangements for that. Recurring payment plans are usually offered to patients that have been a patient of record for more than a year. Some offices are even getting away from this, but if you are going to be setting up a recurrent payment plan, usually through CardPoint, you need to make sure that they've been a patient over a year. Ultimately, the doctor is the one who dictates that. The doctors get paid off of collections, so if the doctor wants to make a rule that is more aggressive than that or more lenient than that, they're welcome to do that. Care credit is usually offered to patients who have been a patient of record for less than a year. And then it's our policy to not start an implant restoration until the surgical portion of that implant has been completely paid off. So it's really important to understand that due now portion of the patient account, and communicate with the patient effectively on getting that payment from them so that the office collections can be as high as possible.